Hey guys, Dr. Michael Derry here. So we're going to talk about curing lower back stiffness and achiness with 3 daily moves. And so when I treat patients with lower back stiffness and achiness, whether that's caused from arthritis, changes over time, degenerative disc disease, etc., that stiffness and achiness can still improve dramatically. And there are some things that we can go over to help improve that. And these 3 daily moves will move the needle on how you feel, not only in that moment, but for the rest of your day. So you're going to want to try these out. You'll just need a little bit of space. We're going to stand up for a couple and we're going to get on the floor as well. So just get ready, move with me, listen to your body. I'll put the reps and sets into the description so you can go through and kind of package it how I would package it with clients. But I want to show you these 3 amazing moves to help set you off to a great day. All right, so today I'm actually feeling a little stiff and achy in my lower back. Not uncommon, especially in the morning. And so this first exercise here, we're gonna do about 20 reps on each side. It's called the lunge with rotation, so hang with me. So we're gonna go forward with a big step and we're gonna rotate towards the side that we step with the leg. So if I step forward with my right leg, we're gonna rotate to the right. And then I'm gonna step forward with my left and rotate to the left. And what you'll notice is I will continue this for about 10 reps on each side. Now, you just notice I stumbled a little bit. Sometimes we lose our balance. Sometimes we don't. A big step forward and then lunge and rotate. And so you're going to notice that I tend to not hold there. I'm just lunging and rotating. Lunging and rotating. Lunging, rotate, lunge, rotate. Lunge, rotate. You guys get the drift here, right? So lunge with the left, rotate to the left, lunge with the right, rotate to the right. Now, you will also hear my breath increase and things are just having fun, but your spine is made to flex and extend and rotate. And so when I'm thinking about improving stiffness, achiness, uncomfortableness, tightness, any of the nisses, we're going to use rotation, flexion, and extension to do so. And what I love about this, we're almost there, is that it gets your body moving and it works not only on your back, but your hips. It's called the lumbo-pelvic complex for a reason. So we're improving that lumbo-pelvic complex. We're lunging and rotating, lunging and rotating. You'll notice that I'm going backwards now. So I'm just stepping forward and I'm taking a step back. It's the same lunge, okay? You guys should feel it in your quads, glutes, upper back, lower back. Let's use an example that I have a problem rotating to my right without lower back stiffness. Well, then I'm gonna take my time, rotate, and stop just before I feel that stiffness. And what that allows me to do is listen to my body, but improve stiffness along the way. So that's the first exercise. Now let's move to my favorite 1-2 punch to finish off improving that stiffness and mobility. All right, you guys think I'm kidding here, but literally I do this every single day. You can ask my wife, and I don't care where we are, friend's house, Airbnb, doesn't matter. We're gonna move into my last 1-2 punch, which is the yoga poses or shavasana or downward and upward dog, but we use it with a spine focus. So I'm gonna tell you what you should feel and little nuances to get you that little extra bit that a lot of people don't know. So we're gonna start on our belly. We're going to press up. And the key here is to only press up to where you feel some stiffness in your back. I was working with a guy just the other day where he could only press up 1 inch, and that's okay. That is 100% fine. Is the goal to straighten your arms? No. Is the goal to go as high as you can? No. The goal is to listen to your body, learn your body, and while you're learning your body and improving that stiffness, you're going to learn different nuances that work best for you. So trick number 1 is don't press up more than you feel like you can. Trick number 2, breathe out at the top. Getting the air out of your lungs will allow you to get more out of the range. Pressing up. Let me change my angle here for you. We're at about 6. There we go. Secondary benefit. Oh, I'm feeling this triceps work. You heard me hold my breath on the last one. That was not good. All right, so after you do about 15 of those, you're gonna go right into the downward dog. So we're gonna have a nice firm plant with our hands. We're gonna plant with our feet and we're gonna stick our butt in the air. Let's see my angle here. There we go. So you're gonna see me pedal my feet. We just worked into extension of the spine. Now we're working into flexion and improving neural dynamics. That's the tip and trick here, is that this ankle pump is very important to improve neural dynamics. We'll come down and rest. About 10, 15 pumps. Take a break. Come back up. Pump, pump, pump. Ooh. Now, as you get more loose and do more reps, you're going to feel like you can stick your butt further into the air. And that's absolutely true. So you're going to want to dive, stick those heels down, stick the butt in the air, and pump, pump, pump. I have not treated a patient or met an individual that when they do those exercises and they do the standing lunge rotation with the downward dog, with the prone press, that they don't feel better afterwards. And so use those movements to help you start off your day and seriously improve that lower back stiffness and achiness. Now look how high my hips are going. I feel so much better, so much looser. Dive and push those heels down. I don't care if you can't touch, I can't touch. I don't care how high your butt goes. Just doing the movement and showing up will allow you to at least get some improvement and feel better. Now, every day you keep it up, every day you're gonna notice little victories and little wins where you're gonna feel like you can get further into the range and your back feels a little bit better, and you're giving your body some TLC. And if everybody did this, I would see less low back pain patients. And so that's what I want, is people be able to take control, improve their back stuff at home. And they don't need a ton of help to do so, but you just have to show up. So if you guys have any comments, please leave them below the description. Tell me how you felt afterwards. I would love to know. And as always, guys, stay healthy, keep moving, and take care of yourself.